I was trying to achieve apathy. And that I felt like if I could just get to not caring, it wouldn't hurt so bad. But the reason that I can now say the word suffering, or that I was suffering so badly, is I cared so deeply about my team, my associate directors, the residents, the patients we cared for, the futures. I wished for all of them that I couldn't step away or take care of myself because it was too like, no, they need me. I have to do this. I have to. And I couldn't separate it. And so I was looking for apathy.
Welcome to Success Reimagined. I am Dr. Amna Shabir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well-being. I am so glad you've joined me. Let's reimagine what's possible together. Your teachers and educators leave a lasting impact on your life, either positive or negative. Their words can scar you or help you soar. Today, I have the tremendous honor of sitting down with someone who helped me soar, my residency program director, Dr. Abby Spencer. Dr. Spencer and I first met during my internal medicine residency at the Cleveland Clinic. She now serves as the professor of medicine, vice chair for education in the Department of Medicine, and director of the Academy of Educators at Washington University School of Medicine. She is a nationally recognized leader in internal medicine and medical education, known for her fierce advocacy for trainees, women in medicine, and compassionate leadership. A master clinician, award-winning educator, mentor to hundreds, including myself, Dr. Spencer leads with excellence, integrity, and heart. This conversation means a great deal to me. Welcome, Dr. Spencer.
Hello, Amna. It's just wonderful to see you, and thank you for that very warm welcome.
It's my pleasure. I have been truly waiting for this moment, and when I reached out to you, this is what I wrote. My book project and any writing project that I'm going to do that has anything to do with my trajectory of life will be incomplete without having a conversation to you. And I know you're so busy, so thank you for graciously agreeing to sit down with me and having this conversation today.
It is my honor and pleasure. And I hope that you will call me Abby.
I'm going to try. You know, it's really hard for me. We are going to jump right in, and I'm going to ask you this question. What does the word perfectionism mean to you?
So, great question. I think it means striving for excellence. And also, when you ask about perfectionism, my mind immediately goes to imperfections. And so I don't know if that makes me a perfectionist or not, but even in listening to your intro and thought, oh gosh, all the things she could have said. So it's a sense of holding ourselves to very high standards, to aiming for excellence, and then maybe also embracing our humanity and knowing that what connects us is our imperfections. And so that balance between striving for excellence, holding a high bar, wanting to reach it, wanting to empower others to reach it, and also having to acknowledge that none of us are perfect. And if we were, it would be a lot harder to connect in the world as humans. And so maybe that just helps me embrace my imperfections more. But that's where my mind goes as far as a definition.
In there, you just said that our imperfections connect us. I want to expand on that a little bit more.
You want to, or you want me to?
Yeah, I would love to hear your thoughts behind that.
I don't know that I had ever really thought about perfectionisms or imperfectionisms using those language. I think I was always driven and had goals or dreams and wanted to reach them and had a sense of self-efficacy. And if you work hard enough, you can get there. And then you learn hard lessons about all of the things that kind of get in the way. And you think, is that me? Is that the world? You know, what's standing between me and the impact I want to have? And somewhere in my early years of being an associate program director, a dear friend and mentor gave me a book by Brene Brown. And it was my entree to Brene Brown, which you know I love. I probably quoted her at your graduation as well as your recruitment to our program. But a decade before that was before it was cool to talk about Brene Brown. My friend and colleague and mentor gave me this book called The Gifts of Imperfection. And it was, I even actually grabbed it because I didn't know if we would talk about it, but The Gifts of Imperfection, let go of who you think you're supposed to be and embrace who you are. And that was really, even the title alone, when she handed it to me, I thought, why are you giving this to me? What did I do or what have I conveyed? So even there of the flaw of like, why does she think that I think this or what? And then it was, okay, I mean, just dive into the book. And I really found it inspiring. And I felt like it gave me a lot of vocabulary for feelings that I had, but maybe not the words to put to them. And even in the title, The Gift of Imperfections, and Brene Brown talks so much about that our imperfections are the humanity that binds us together. And so when we are sort of ascribing to be perfect, or we're not letting ourselves fail, or we're feeling like we're failing, to kind of have a good news moment, I'm human. Or the other piece I really took from this book, I think this was the first time I had heard or learned the phrase that shame can't live if you share it. And this sense of, she went out searching to study what connects people, and instead learned about what drives this disconnection and the sense of shame, which often comes from feeling like you failed or you're imperfect. And I've just really appreciated her talking about, number one, shame can't live if you share it. It's something that isolates you and keeps you pulling back from humanity and connections. And as soon as you acknowledge, I'm imperfect and I either made this mistake or didn't achieve this goal or learned I'm not as good at something as I wish I was, that is exactly what connects you to others. And so I have carried that with me through life, through being then an associate program director, now a program director. It obviously opened me up to all of her other books to come, which have been really profound for me. But this was really the start of it. And that's where I think the words perfectionism and imperfectionism kind of came into my world. And probably when I saw that question, my mind went to this book of, oh yeah, I remember that.
That was beautifully shared. I love that book. It's probably hanging somewhere in the back right there. I completely agree with this phrase in terms of our imperfections connecting us, because the simplest way I can describe it, when you pick up your cell phone and you're scrolling on Instagram and you look at those amazing, flawless highlight reels and pictures, like how connected do you feel with that influencer or that person who's sharing that? I, these days, in this season of my life, feel most connected with all the influencers that are showing real-time parenting and momming, and they'll add humor and self-deprecation in there. And there's just like this instantly, like, I see you. And for me, that right there in a nutshell, we'll talk about connection and perfectionism and, how that links up. So I so agree with that. Now, from your personal journey, and if I was to put that lens back, I mean, you got that book as a gift from your friend. Can you think of any moment in time personally, and you can take us as far back in time as you want to, where you felt that you were affected personally with perfectionism, either yourself or you felt that others were putting that pressure on you to be a certain way or perform a certain way?
I'll have to think out loud with you for a moment. But I think about the concept of really bringing your whole self in. And I think there are, at least for me personally, spaces where I maybe felt like I had to be a little bit more perfect, or that there was less room or less forgiveness for error or for mistake or for failure or for imperfection than others. When you were, even again, I'll go back to, your intro of me, and you're reading these accolades. And I think, if you saw how messy my kitchen was right now, or, what would my 16-year-old say about that? And so just that sense of, you can be you're never going to reach perfection in any of them, but you may be kind of killing it at one space at the expense of another. And then how do you look at that globally and feel, well, gosh, you're saying all these great things, or I'm winning these awards here, but I'm not, does it not align with your values, or are you not really killing it in the ways that mean the most to you? And so I think the definition of perfection has sort of changed for me a lot. Of, if I'm living my best life, am I living by my values? And that does include family and my children and my husband, and connection to community, or being a mentor and sponsor. And even some of what we were talking about before, when I was an early associate program director or program director, I wanted to show I'm tough, I'm strong, I can do this as hard. And I didn't yet have the Glennon Doyle language of, we can do hard things, and be able to talk through that. Right. And then realizing, when I just it's the moments of breakdown that people are like, oh my gosh, you're human too. And then there's more empathy. You actually can kind of pop back up and go another day. And so I don't know if I'm even answering the question, but I'm just thinking about just all the places that I want to show up and be.
Yeah.
And maybe that is the excellence that I strive, is to just show up in the places that are meaningful to me.
I'm going to pick on the word failure that you just mentioned, because one of the things that is really drawing me to explore the next phase of this project and asking individuals is like, how are we dealing with failure? And so how do you deal with failure?
I think, again, it depends in what sense. So, there's the mom fail of forgetting to send your kid with X, Y, or Z on the day that we need it. Then there's do you launch into a new innovation or a new project or something that you really put a lot of resources and time in, and it maybe doesn't go how you want it to go. And that's a different sense. And there's a little bit of like, well, who's watching? Is it my own, I didn't reach the bar, or how heavily am I being scrutinized, or will I be scrutinized? Because sometimes the largest failures you learn from, and you're like, okay, well, now I know. And then there may be really small ones that, particularly as women or women leaders, we feel like maybe we don't get as much rope, or that our mistakes are spotlighted and amplified more than others. And so there's also that sense of what was or wasn't achieved, but then kind of looking around and saying, well, who watched and who knows, and what are the implications? And can I just stand on that failure and have a better view to now know what doesn't work so that we can move forward and do what works? Or is it going to invoke shame or consequence or things? And sometimes it's hard to predict. And I think about Thomas Edison's quote around figuring out how not to turn a light bulb on, right? Or all of the things of knowing that if you're someone who likes to innovate and you like to build and you want to really push the envelope, there's going to be multiple failures or things that don't work. And that's how you get there. It's never the first idea. And at the same time, what's the safety and the permission and the trust and the space to do that? And so some of the maybe more mom fails are feeling like I could have or wish I showed up in different or better ways for my kids might have nobody else looking but feel the heaviest. And then there might be much more public ones at work that aren't a big deal, but they're made to be one. So it's a complicated question.
It is a complicated question. And I appreciate the way you broke it down between the professional and the mom fails, because I feel that the bucket of mom fails and mom guilt is very, like, I can so relate to it. I think that the other ones are there, and I have worked through a lot of what the shame and the expectation that comes around from my other roles, whether it is that of being a South Asian woman, that being a woman in medicine. Like, I feel I can reckon with that a little bit better with all this work that I have done. But the mom bit, it keeps surprising me. Like, here you go. Here's one more. This Teacher Appreciation Week as we record. And this morning I was like, well, did you like put all the things and get things ready for your teachers, like the cards, the gift cards? The girls were like, yes, mom. But I was just feeling like I'm behind. Very well said. I want to tease a little bit more about being a woman in medicine, being a woman leader in medicine. When I was in my residency, you were one of the youngest women in medicine at the position that you were at. And you, of course, have such brilliance. And I know you're trying to be very humble and modest. And you are always like that. I mean, for anyone who knows you in real life, that's how you present. But to have achieved so much at a young age, and you're right, like, what is the margin that is allowed to you when it comes to you showing up perfectly? Like, you don't have a lot of breathing space. How has that journey been for you? And maybe some of the insights where, when I was there in 2012, 2014, conversations to when we're recording this in 2025, any thoughts on this journey? And especially you being so young again. You're so young, and you're doing all these amazing, phenomenal things.
You're too good to me. I feel like such an old lady. So thank you for saying all of those things. And yeah, I think that there is a lot that goes into the extent of pressure that we feel to be perfect or to perform. And we all have the sort of baseline level. Of course, for the most part, nobody wants to fail. Then you add on the pressures of being a woman in medicine or a woman in leadership. Then you add in the pressure of youth, and maybe even you are young, then you look younger. At least I used to look younger than I even was. Now maybe I look older than I am. But all of those, and then what's the majority group around you, and all of that can heighten the pressures to succeed and to achieve the goals. And again, I think that sense of not all identities have same access to the trust to, if there are mistakes or there are failures, that you figure out what you need to do to recover from them and rebuild. And so that sense of, will I lose the chance to do what I most want to do, the impact I want to have, if I don't get it right every time? And when can you finally exhale a little bit and say, I've put enough into the bank, not the money bank, but the trust bank or the achievement bank, to show I deserve a little more rope, and let's see what I can do? Because the ability to succeed really, I think, depends upon the ability to take risks. And if you're paralyzed by potential for failure or consequences of failure, then you're not going to be able to A, perform at your best, or B, be able to take the risks or make the changes that are needed. And so if we go back to the example of becoming your program director, I came into a program that had almost doubled or tripled in size overnight because a new program a hospital had closed. All those trainees came over. And I was told essentially to shrink the program without shrinking the program. And what that meant was to give the feel of a small program to this now enormous program of over 200 residents, and maintain the culture and the level of excellence, and yet change the feel. And so to me, the way I went about it was to change the word cloud. And so if you've seen a word cloud, it's you have everybody put in the words that describe whatever the question is, and the things that are said more than once get bigger. And if somebody just says it once or twice, it's smaller. And so with the leadership and with groups of trainees, I would ask questions and then show the word cloud of how are we describing who we are, and then ask questions around, well, what's missing? What don't we see? And I noticed that, especially with our faculty, when we talked about what we were most proud of, tell me about what it's like to be faculty at this place, I wasn't seeing the words education, mentor, teaching, curriculum. There was excellence in a lot of different ways, excellence in scholarship and excellence in care and access to subspecialties. And there was a tremendous positive, but I wasn't seeing the things that went to how do you shrink a program and make it feel smaller and feel like people have connectedness and the safety to be their best selves. And so to do that, there had to be a lot of cultural clashes and changes to say, we're going to have to do this really differently if we want to have a really different result. And to come in young and come in female and come in from the outside, the skills around building consensus and helping people feel heard and tying things back to mission and values and impact and outcomes to get everybody on board with that, we had to start with writing a mission statement. The residency program had never had a mission statement. And so we brought large groups together and we had a mission statement and a vision, and then say, okay, how do we get there? And how do we get there together? And I wonder if someone else could have come in and done that quicker or faster or with more resources. But again, I had to earn every permission to go to that next step from the first step of, are we still with me? Is that still our mission? Do we think we're there yet? No. Okay, let's go. And so I think that there's a lot to knowing how much risk you can take in the setting that you're in, and then, highlighting and spotlighting the small wins when you have them, and then taking a deep breath with the failures and kind of owning it of, okay, we misstepped or I misstepped. And I thought that if we did this, it would get us there. But do we think we're there yet? No. Okay. What else should we be doing? And then again, make it less about me being right and more about getting it right for the purpose of what we were trying to do. And I think that's also helped me through a lot of failure, or sort of bringing, again, youth or femininity or compassion into leadership in a place that was very cold and impact oriented and task oriented and not necessarily people oriented. And so how do you bring in your gifts and make what someone else's weakness your superpower? And to me, compassion and empathy and love of people was my superpower. And there was no way I could use any other because that's what I had. And so it's how do you lean into that? Some people may see that as an imperfection, and it may be if I care too much or all of those things that can maybe blind you from making hard decisions or doing things, then you have to learn to work around those and again, bring in other people to help mitigate the failures and move you towards goal.
It's so great to hear about all the behind the scenes today because we're on the other side and we're seeing it from a very different standpoint. And when I became an attending, my recognition and compassion for life after medical training was it did a 180-degree switch. And then so after being an attending for 4 years, when I went back for fellowship, I used to check in on my attendings. Well, how are you doing? Because so much is happening behind the scenes, which a lot of times we can't see. And I love that you brought in your femininity and I saw it. Your office was so fun and so cool to hang out in. So you really, and as Dr. Sasha Shilcutt says, you brought in your she manual instead of like following the manual, which is wonderful, bringing in your own rules and leading with that. I have seen you, and I'm going to get deeper here a little bit more. You have shown up on social media relentlessly and authentically as yourself, and you're there. How are you staying constant where you're at? Like from the outside, it does look like you are present academically and online and for your trainees, and you're doing all the things and you're not burning out. That's what it shows from the outside. How are you doing it all, if I was to say this? And I know you mentioned your kitchen just now, so it makes me feel a little bit better.
I do have a very messy kitchen. And I was struck by that question when you sent one to me around, how is it that you never burned out? And my response was, oh, isn't that sweet that you think that? And again, I don't know that anyone I guess I have seen people go to social media with anger or with I'm burnout, but in all of my days where I was very engaged with it and any of the talks that I gave on don't tweet angry. And I think that probably applied to my period of burnout too. But no, I would say in my probably 7th year of being a program director, maybe between year 6 and 7, I burned out. I burned out hard. I don't think I could have or would have used those words then, but I was despondent. I was sad. I felt incapable. I felt like I can't give the residents what they need, what they deserve. The fight's too big. I have nothing left in me. And you could look back and, oh, I know what that's called now. But at the time, you're just in this tremendous sense of incapacity. And at the time I had, I think it was 5 or 6 chairs in 4 years. And at one point I was working for someone that I really perceived as a bully and that was putting up barriers to everything we were trying to do. And that definition of insanity when you keep running into the same wall and expecting something to be different. And so I was like, oh, let me try this way and that way, and tried every different way I could. And it wasn't working. And I deeply internalized that of it must be me, maybe someone with more skills or more experience or who was tougher, who didn't care so much, could do this better than I could. And it was a very tough and hard experience. And I'm grateful to the people that could hold up that mirror and say, you're not you. Like, this isn't what is happening. Because sometimes you don't even know when you're going through it. And so it's interesting when I read your question of how have you never burned out? And I was like, oh, I'm not like, there must have been a few years where we were not chatting with each other. I have a very close, dear friend and peer mentor who still reminds me of the time I was having a very deep discussion with her about how I was trying to achieve apathy. And that I felt like if I could just get to not caring, it wouldn't hurt so bad. But the reason that I can now say the word suffering, or that I was suffering so badly, is I cared so deeply about my team, my associate directors, the residents, the patients we cared for, the futures. I wished for all of them that I couldn't step away or take care of myself because I was too like, no, they need me. I have to do this. I have to. And I couldn't separate it. And so I was looking for apathy, thinking that would be the answer if I could just not care. And she was literally like trying not to laugh in my face at the time. Like, Abby, I don't think apathy is what you're looking for. And she said, no, I also don't think that you're capable of that. And so it's the fact that you care. And so it was an interesting time. It was a really interesting time. It was a tough time, but I certainly hit burnout. I think now I recognize it in myself or others in different ways. Resilience has new definitions to me. And I appreciate that maybe some didn't know, but I feel like it wasn't hard to see for anyone that came in contact with me during that time, because there was a dimming of the light, and I certainly felt it, but I think I didn't realize anyone else could know. That's the other kind of funny thing about burnout, is we think like that we were hiding it really well. And one of the biggest things I learned was no, I sure wasn't.
The word that's coming to my mind right now is grace, because you show up so on social media, whenever you present, there's radiance and there's positivity when you're sharing your activities with the residents, the fellows, the conferences, your children. And I find that as a soft space, because when you go online, there's all kinds of things there, and whether they're personal, professional, political. And whenever I see you present yourself with such grace, and I think I want to actually model that, because if you are going through active burnout, and also acknowledging your experience. Thank you so much for sharing that with us, which is so awful. But recognizing that when you're actively going through something hard, that doesn't entitle the whole world. Just because we're talking about vulnerability and authenticity, that does not mean that everybody gets to have that direct front row seat to your experience. And a lot of times people worry about showing up a certain way. And I feel that it's completely okay if you continue to show up with grace and respect in your amazing leadership role and continuing to have the light out. And thirdly, I want everybody to go back and listen to that you were aspiring for apathy, because I feel that today you've given me a sentence for what I have on some level still aspired to, because right now as a geriatrician, my clinical work has been in the long-term care space. And I feel this is the first time I probably am going to say this on air, but Dr. Spencer, you make me do these kinds of things, so I'll say it. I feel that I am the doctor nobody cares about in a system that nobody cares about, and with my patients that nobody cared about, working with staffs in those facilities that nobody cares about. And there was veracity to my statement. And so I'm very aware that I don't have burnout right now. Actually, I have severe moral injury, because every time I go there, my hands are tied, and whatever I'm experiencing, my patients have no fault. And they're there, and they're so amazing, and they're so lovely, and their families are incredible. It's just, we are the stepchild of medicine. Like, nobody cares about the patients in the nursing home and rehab facilities. And so every time I come out, I journal, and sometimes I do cry, because I feel that so much deep in my bones. But then I tell myself, okay, like, what can I do? And all of this other stuff that I've learned that allows me to cope, but I can cope, but I can't gaslight myself. This is moral injury at its best right now.
Yeah, and I appreciate you sharing that. And I'm so grateful for what you do. And so the generation, what do we call it? The sandwich generation, where we're taking care of kids and parents. I mean, I'm more grateful for geriatricians than ever and what we learned from them. And I know that feeling of nobody cares about what I care about so deeply is really painful. And I think we did have very similar experiences in that sense of when you care so deeply about something and you look around and you think nobody cares about this, nobody else, it can feel exactly like moral injury. It's disheartening. It's heartbreaking. It makes you question, well, what's wrong with me, or why do I care so much? One thing that I did think about that at the time was helpful to me, and I don't know if this will be helpful to you or not, but someone said to me, Abby, as the residency director, who should care more about this residency than you? Nobody should. It is your job to care more than anyone else. And that's what makes it hard, but that's what makes you the person for this role. And I wonder if similarly, no one's going to care about your patients the way that you do. No one can, and maybe no one should. And is the system failing primary care at large and healthcare at large and geriatrics? Absolutely, for sure. But to take some solace and you care the most about those patients because you do, and that's what you should do, and you signed up for it, and that there's nobody that can or should care for them more than you do. And so I think if taken out too broad, then we do feel like we're gaslighted. But sort of in those moments of it hurts to care about something, feeling like no one else does, then like reframing to that pride of, yes, I do. And that's why I'm here, because I care about this group of people, or for me, this group of learners more than anyone else.
Beautifully articulated, and I completely agree with that. I'm going to hold on to those words. So now I'm going to switch gears a little bit, and we're going to go in deeper. And so for our audience, I'm going to give some context and a little bit of background before I ask my next question. During residency, I received a serious medical diagnosis on the very same day I found out I was expecting my first daughter. That day, it's seared in my memory, and it's not just because of the news, but because of how the people around me responded, which is an incredible, like when I look back at that memory. From my chief residents to Dr. Spencer right here, it was one of those rare stories. We don't talk about these kinds of stories enough. That when I look back at that time, there was no shame, no guilt. There was just unwavering support, and I was encouraged to go to every medical appointment without question. And beyond that, Dr. Spencer, you gently encouraged me to consider counseling. I still remember you pulled me aside in the hallway outside the cafeteria. I still remember every bit of that. And you recommended that I go and I process the emotional weight of having this complicated pregnancy. And I'm going to quote Maya Angelou here in a positive light, because a lot of times this quotation is, I have remembered this quote in a positive and negative light. So I'm going to say this: people will forget what you said, forget what you did, but they'll never forget how you made them feel. And that has stayed true to me. There are two instances. One is extremely negative and one is extremely positive. And I'm going to highlight the positive, which is what you did. In that moment, I didn't have a formal mental health diagnosis. I was fine, completely fine with air quotes, but I was clearly under a lot of stress. It was a period of 24 hours that I got all this news. Why did you feel it was important for me, and you encouraged me to seek counseling and take care of my mental well-being? What was going on through your mind? Why did you care? We were such a huge program of residents.
From my memory, and this was 8 years ago? I vividly remember visiting you in the emergency room bay, and what I saw was suffering. And I recall you looked exhausted, overwhelmed, terrified, and all understandably. I mean, this was very scary, what was happening. And through what I could see in your eyes, in your trembling voice, in your words through tears, as I'm getting caught up on kind of what's going on with you and why you are here in our emergency room, your focus and what you were asking me about was getting back to work. And all of my questions to you were, what's going on? How are you? What do you need? What happened? What can we get for you? And your questions to me were, can I go back up? Who's covering? What about the pager? What about my patients? And you sounded so pressured and so exhausted, and you needed permission to rest. And I felt like that was the greatest gift that I could give you in that moment. I was not your treating physician. You were my resident. But what I could give you was permission to rest and permission to take care of yourself, which involved your physical health, your mental health, diagnosis or not. You were hurting. And I needed you to make that investment in your own physical health and your mental health so that you could get back to these things that you cared so much about, your patients, your colleague. You had the strong sense of not wanting to be a burden to anyone. And I was worried about you because that is the recipe for burnout. And I love that you said I was fine. I don't know if any of you have read Jessie Gould's book yet, but she was at WashU for a number of years. I got to overlap with her. And I love every time she says, fine stands for feelings I'm not expressing. And so anytime we refer to ourselves as fine, I just go to her definition. But to me, it was just too important to give you that permission and encourage you to invest in your own physical and mental health, and not about getting back up to the floors. And again, back to that humanity. And then also just that sense of what have we done to our trainees or to our society that we're not taking care of each other. We're literally the healers. And then how do we not show up to help each other heal ourselves and our other care providers. And so, I appreciate how much you remember it and that it was so impactful. I think for me, it was just, oh my goodness, she needs permission to rest and to take care of herself. And then a sadness, talk about failure, imperfection is, what have I done in this residency that my residents don't know this? Is our structure not set up such that our trainees we know they can't take care of anyone else unless they're doing okay themselves. And so it actually made me think back to the system too. And that I owned part of that. I felt terribly that you were there suffering, thinking you had to get back. And what did I do, or how could I build a program where our trainees know, yeah, you're going to work hard, you're going to be exhausted, we're going to push you to the limits. But if you're not your full self, then we're going to pause and we're going to help you get there, because otherwise our field won't survive and we won't survive.
I'm just going to take a deep breath. And
me too.
Yeah, because those memories are absolutely vivid. And I want to slow down really and model this out for other humans that are listening. We talk about a lot of things that go wrong in medicine, and there are. For my life, I was one of your trainees. And this was a tipping point in you showing up as a leader and how you impacted my personal life. And I have been told from other trainees, my colleagues, they were just like, you need to go. And so to hear this from you, it means so much for me. Okay, I'm going to try to keep going, because yes, that was a tipping point in my life. Had you come in and not shown care, because it shows in the way you present yourself, your body language. If your words are not matching your body language, if your intent is not matching your mission statement, you can work so hard, but that was like the moment in which you completely embodied everything that you stood for, and you paused and you did give me permission to rest. And even despite getting all that permission to rest, I still remember the secretaries were laughing, because in the middle of second year, I had hit all the requirements other than actually graduating, because I was so worried. More than my child's health or my health, I was worried about if I'm going to graduate on time. And I had completed all graduation requirements so early on and being spot on. And you're right. Like now, when I look back, I want to have compassion for myself. I think that all leaders can definitely, I know they need to take a page out of your book. And this is what happens when leaders in medicine truly care. This is what happens when your program director actually cares about you. A time in my life that could have been so traumatic, I can seriously say I don't have trauma from it, because I was allowed and given the permission to rest, the permission to ask for help. And I didn't have the financial stress either. Like, I did have the insurance that was there, and you did make me go and talk about my feelings. I definitely didn't want to do that. I really rolled my eyes internally, and I was very scared. Like, is this going to show up on my evaluation? The fear was real. None of that happened. So today, I really, out loud, in front of the whole world, just want to say thank you so much, Dr. Spencer.
You're an inspiration. Thank you for your words. And I hope we can keep together, and with all the work we do and the people that we train and work with, make the system better so that people don't have to fear their imperfections, their vulnerabilities, or their need for help, and that we embrace letting the helpers help. And again, think more about the impact and the outcomes we most want, and not that they're tied to us. And I think that there's a freedom in that, a freedom from perfectionism a little bit, that maybe the secret sauce is the ability to not only show vulnerability and ask for help, but knowing and depending on that's probably going to help get an even better outcome or impact on the systems or people or programs that we most want to improve or put our whole selves into, that we're not alone and we don't have to be alone. And probably we're going to be, and maybe even definitely better when we do it together, when we let the helpers help. And when we, again, connect through our shared humanity of we all have different strengths and opportunities, but together we've got what's needed to help this patient or this learner or this trainee, whatever it is.
Thank you so much for sharing that. This has been a remarkable conversation. And that's why I left the part where I knew I was going to end up crying towards the end. Any other words of wisdom as we wrap up for today? And specifically, if you were to address other leaders in medicine, other program directors who are, I have, again, tremendous respect for them because it's not easy for them either. And I really want to say this out loud because a lot of times we forget that those people, we focus, and I want to create this bridge where trainees are cared for and also leaders in medicine feel like they're cared for. How would you advise somebody to show up if they're, I gave a very specific example, but any words that you wish other medical leaders can model, learn more?
Yeah, I think I'm taking in your wisdom and your words, and all stages are hard and leadership is hard because you are feeling the same feelings and pressures and uncertainty, especially currently that everybody is. And yet you're being looked to lead, to have the vision, to have the answers when you may not, and you may have as much sort of fear and uncertainty. And so I think the words that I would leave us with are first just empathy, having empathy for, I wonder if there's something more about this situation that I don't know. If I trusted this person yesterday and now they're doing or saying something that's not consistent with that, do I either trust that there's a reason, or am I curious around, are they okay? Is this person hurting? What do they need? And then I love the quote I heard once about we learn to lead when we care about something. And if it starts with the caring, and then the fact that we learn to lead, that sense of that growth mindset of we're not going to know upfront always what to do or how to do it, or see experiences or things, or that word we all have come to hate of unprecedented, but things coming our way, but you know that you care. And so you learn to do what you need to do and who you can rely on to help you through that. And then finding the inspiration from wherever you get it. For me, it's from books and quotes and Brene Brown and Simon Sinek, Start With Why, and We Could Do Hard Things, and from my trainees. But I also get inspiration from my kids, from looking at the ocean and just realizing how big the world is and how small this thing is. And so just whatever grounds you, is it ocean? Is it family? Is it a mountain? Is it books? I recently read the book, Have the Courage to Be Disliked. And I think, again, if we're thinking about perfectionism and really thinking about getting it right versus being liked, those are all dancing around the same area. And then give yourself and others grace. And you brought this up too, of just how can I'm doing the best I can with what I have right now. And then I think Maya Angelou also said that, do the best you can until you know better. And when you know better, do better. And so if we give the grace for, I did the best I could with what I knew, and now that I know more, including that didn't work, now I can do better. And so may we all just give each other grace to do better when we know better.
So powerful. Thank you for your time today.
Thank you. And I love seeing you shine and thrive. And I'm so happy that you're healthy and well and healing the world. I am grateful for that.
This episode is part of a special series and my budding book project on unmasking perfectionism. You might believe you don't have the time or energy to focus on yourself, but this is exactly the right time to get serious about your well-being. You don't have to do it all alone. I'm here to help. If you enjoyed this video and are ready to take the next step, head over to dramneshabir.com, where you'll find free resources you can access right away. The website link is below. Let's get started on your path to thriving. Thanks so much for spending time with me today. Just a quick reminder, while I am a physician, I'm not your physician, and nothing in this podcast is medical advice or any kind of professional advice. Everything shared here is based on my personal experiences, and the views expressed are entirely my own. If you enjoyed today's episode, I would love for you to rate, review, subscribe, and share the show with anyone who might need a little inspiration to redefine their own version of success. I'll see you next time. Until then, keep reimagining success one small step at a time.